Now going into our next momentous occasion of the day, which is to witness the second inaugural lecture of the day by our ever-esteemed Professor Dr. Sanjay Rampal, Lekhraj Rampal, a renowned and highly respected professor in epidemiology and public health, to share his journey in the field with us with his lecture entitled Obesity and Public Health, Challenges and Opportunities for National Prosperity. I would like to invite Professor Dr. Yang Farida to the podium to chair and subsequently introduce Professor Dr. Sanjay Rampal. Please welcome Dato.
Hello again. If you did not know, my name is, I am actually very, very honored and very happy to be able to do this again to the second luminaries of the Department of Social and Preventive Medicine. Standing before you today is Professor Sanjay Rampal. He is a distinguished epidemiologist and public health expert. And since September 2021, he has served as the Deputy Dean of Research at Universiti Malaya's Faculty of Medicine, and I am so grateful for that. He has significantly contributed to enhancing the institution's research output. In this role, he provided mentorship to junior faculty and helped steer research in Universiti Malaya and Malaysia towards a future of impactful health solutions. Now, Dr. Rampal's career began in India as well, with his medical training. It is interesting how their lives seems to intertwine very closely, followed by years of service in Malaysia's Ministry of Health. His early clinical experience illuminated a key insight that he felt, that treating individuals was valuable, and a lot of us who are clinicians chose it because we felt that we're making a difference in our patient's life one at a time. But Sanjay thought big because he felt while treating individuals was valuable, addressing population-wide health challenges could make a far greater impact, and he's not wrong in that. This realization led him to pursue a Master of Public Health at Harvard University in 2004. I really don't know how that connected because, from realizing that I need to do it and going to Harvard, but that's hard, Sanjay, for you, right? And a PhD at John Hopkins University in 2014. And he actually obtained a certification in public health by the United States National Board of Public Health Examiners in 2013. So I feel as if here again, similar to Victor, I need to say thank you for staying in Universiti Malaya. Dr. Rampal's research primarily centers on cardiovascular disease prevention, examining the role of factors such as gender, ethnicity, obesity, and nutrition in diabetes and heart disease. His recent work delves into communicable diseases, particularly how conditions like obesity and diabetes influence severity and prognosis of dengue. His extensive research contributions include 120 peer-reviewed publications, H-index of 34, and more than 18,000 citations on Web of Science, making him a highly respected figure in his field. His ultimate aim, because he is always going beyond what is expected, his ultimate aim is to transform these research insights into effective prevention programs that will relieve the burden on healthcare systems and improve community well-being. Beyond research, Dr. Rampal is a dedicated educator, teaching epidemiology, biostatistics, and research methods. He has mentored many postgraduate students, many of whom have gone on to make significant contributions in their field. He is a fellow of the Academy of Medicine Malaysia and has held prominent roles in public health organizations locally and internationally. During the COVID-19 pandemic, he played key roles on national committees such as National COVID-19 Epidemiology Analysis Task Force, ensuring Malaysia's response was guided by evidence-based strategy. He also leads the Western Pacific Regional Training Center for the Special Program for Research and Training in Tropical Diseases and serves on several global health advisory boards, including the Global Health Program of Association of Pacific Rim Universities. Despite his impressive accomplishments, Dr. Rampal remains approachable and humble. Whether engaging with students or the media, he conveys complex public health issues with clarity and calm, underscoring his commitment to improving health outcomes in Malaysia and beyond. I have to reveal here that the only reason I agreed to a dual inaugural lecture by two of the luminaries of public health at the faculty was because Prof. Sanjay approached me and in his usual calm and methodological manner broke down the evidence-based justification why this was a good idea. Number one, he said both Victor and he agreed to it. In fact, he said Victor approached him, so we know now who was the budak nakal. So Victor approached him. The people who are coming will be people from the same faculty, so why do it twice? We can save cost on electricity, on water, and on food, and so on and so forth. People spend less money to drive to this place because they are getting 2 for 1. So he kind of convinced me it was a sound idea at that time. And then he flashed his Sanjay patented smile. And I said yes. So let us now enjoy Professor Sanjay Rampal's lecture on obesity and public health, challenges and opportunities for national prosperity. The floor is yours, Prof. Sanjay.
Just let me start up my timer. Victor did an excellent job at timekeeping. All right, so I have 45 minutes from now. Huh? Okay, no worries. All right. So good evening, everyone. So my name is Sanjay, right? And without further ado, I will move on with my inaugural lecture. Now coming to the topic, right? I think Prof. Young has given you the precedence to why we are doing it together. But I think the topic was an interesting one, because when I look back at the work I've done, right, I was wondering, how do I anchor my lecture? My research has covered actually a wide, diverse areas within cardiovascular disease and cancer. But to anchor the research, I thought, to anchor my lecture, I thought, let me go through my publications. And when reviewing my publications, I saw that obesity came out from my publications. Interestingly, in preparation for this presentation, I did a word map. So the word map, can we have the presentation on? Yeah, excellent. So in preparation for this lecture, I created a word map of all my publications, and this is what the word map on the right, right? So these words are words that frequently appear in the titles of my publications, right? As you can see, Malaysia is there, right? A lot of my research is based in Malaysia, but you can see obesity comes out, risk, prevalence, population, associations, a lot of things that actually, to summarize it, one way is to say that it's in the field of cardiovascular epidemiology. But then if I was to come and speak about cardiovascular epidemiology, I might need 2-3 hours and go past the 45 minutes. I'm already 2 minutes into my 45 minutes, right? So I kept it simple. I said, I will talk about obesity, right, and public health. Now, this is just one way of saying the two things that come up in this image here, right? The image on the right actually echoes the previous presentation. There are many ways to reach our destination. There is no one fixed way, right? So just to say that this is my journey, This is the road that I took. This is basically my path that I followed. So during the lecture, I plan to cover aspects of my research related to obesity. Particularly, I will limit it to 4 papers. These 4 papers come from 4 different time spans of my career and expertise. In addition to that, I hope to talk a bit about my career, very little on public health, and a few lessons that I've learned. I found preparing for this presentation very challenging because sometimes there's a lot that we want to say, but there are 2 things here. Number 1 is, if I talk too long, you all will go to sleep, right? And number 2, I have to keep to time. My promise to Prof Young that we will keep it short, right? All right, so let's move along. I joined Universiti Malaya in 2005, right? At that time, in my interview, I still remember Tan Sri Prof Amin and Prof Dato Sirajun Nolgani interviewing me for that post. And one of the questions they ask is, what do you bring to the table? What can you do for us? And I remember that the answer that I gave was along the lines that I can improve the teachings at UM. I want to capacity build for Ministry of Health. And I find the best way of capacity building at Ministry of Health is not at Ministry of Health, but at a university which teaches Ministry of Health personnel, number 1. And number 2, to bring up the research profile of UM through my specific expertise in epidemiology and multivariate regression, advanced biostatistical methods. So when I first joined Universiti Malaya, there are many luminaries of the department on the slide. And I would like to mention, number 1, Prof Atia, who was the head of the medical statistics unit at that time. We also had Prof Saimi, who was in the health management. And then we have Prof Hamad Ram, who is here today with us from the unit of family health unit. And one thing interesting that happened during this journey of mine is, because I brought in expertise which was transdisciplinary, I found myself at this early stage between 2005 and 2009 to supervising students from many units. So I actually supervised students from, number 1, the EpiStat, but number 2, from family health, and number 3, from health policy and management, right? And in addition to that, we also had statistics services at that time. And during this period of time, I provided more than 100 consultations to our staff and our students. Now, you can also see many of our department staff here looking very, very young, energetic, happy. Many of our photographs on the department are happy photographs. Taken out all the sad ones. All right, now coming on to the first paper that I've done, first major paper that I contributed to on obesity. So this basically portended an early evidence of an epidemic of obesity between 1996, when the NHMS was done, and the year 2004. I've written more about this in the book. If you're interested in reading, you can read about it. But I was very fortunate that in 2004, when I came back from Harvard, and then I joined Universiti Malaya in 2005, I managed to join a research team. The research team was actually led by my father, Professor Dr. Lekhraj Rampal. This posed a very interesting, very interesting relation dynamic. Right, on one part, we have personal relationship, but we have worked together through time. And I think what has happened is, what has resulted is, we have come up with a professional relationship. When we discuss research, when we discuss public health, we are professionals, right? We may not have the same viewpoint as anybody else, but we are professionals when we do that. And one thing that we found is, with this group, I could basically contribute 2 ways. Number 1 is with the use of complex survey analysis. So at that point of time, many of our surveys were using simple statistics. Believe it or not, it was difficult to do complex survey analysis. The only program, if I'm not mistaken, may have been, was it Sudan, right? I mean, even in Stata, SARS, it was difficult to do. SPSS, you could not do it, right? So I contributed to the group initially by coming up with the methodology and the analysis of performing complex survey analysis. And what we found is, we found here, let me use this. Okay, so what we found is, we found a prevalence of 11.7%, right, among a group of 16,127 respondents who had their waist and height measured. And this represented a 270% increase, or 2.7 times increase in the prevalence of obesity. If you look back at literature, this was one of the first papers that came out that portended this huge increase within 10 years. Prior to this, there was also a men's survey that was carried out, but the men's analysis came out at a later period, at a later time, right? Now, I remember discussing these results with some international academics from Utrecht and from Oxford. And they told me, the first thing they told me is, when you find such a big increase in the prevalence, is what you're doing correct? Why is there such a sudden increase? Is it due to bias? Could there be some issue with your methodology, with the way you collected data? Or could there be a true effect, right? And this got me thinking further, because there was some missing data here, right? There was about 15% missing. Now, in addition to this 15% missing, once we look at these results, we were interested in estimating the prevalence of metabolic syndrome. However, the data, the lab data for metabolic syndrome were further missing, the 40% missing. So missingness was an issue. How do you account for missingness? And with that, I take you to the next part of my journey. So during this time, I offered many courses, right? And you will see the use of this computer lab. This computer lab is a legacy, right, within the Department of SPM. I remember in preparation for this specific workshop, if I'm not mistaken, we managed to obtain many computers actually that were retiring from other parts of UM into this lab. It stayed in this lab until when I was in the head of department, it was still there. We eventually had to remove it, I think, close to 2019, I think. 2018, 2019, 2020. We actually had, but until then, when you come for workshops at our faculty, you would come to a room like this where you work on your labs. Now, in addition to all the work, right, we also had fun, right? And as was tradition then, with those who are joining the department, you get the pleasure of organizing the family day, right? So I remember this family day in 2007, where at that time, the Amazing Race was famous. So we had a family day amazing race. And we actually got our staff and students at that time to run around, all around the faculty and the university, right? And at that time, there was also, we had a large contingent of international students. And we also had a football match, right? And not one, we had a number of football matches in the morning. And I still remember Prof. Atia playing. And he lasted quite long, actually, right? So that Prof. Atia played, and we had a lot of fun with many of the students. And some of the students now are very senior MOH personnel. Now moving on. So from that time in the early 2000s, as you can see, that the group was smaller. Now as we move with time, Family Day has become like an annual tradition where you have more and more students joining in and their families, so on and so forth, sometimes in UM, sometimes outside UM. So now, I was in Universiti of Malaya. I spent about 3-4 years here, right? I was in my early academic years. I was having my early academic career, and then I decided to do my PhD. I did not actually decide to do a PhD at that point of time. So when I think back on why did I do a PhD, it actually started after my master's. So I have to tell you now a story about my master's, right? So with regards to my MPH, to doing an MPH in Harvard, it's actually very interesting. I was, at that time, in the Clinical Research Center, HKL. I was medical officer number 3 in that institution. When I joined, I liked what I was doing. I liked clinical research, I liked clinical epidemiology, and I loved biostatistics at that time. I was working under Dr. Tekon, who was himself a nephrologist and a biostatistician. And in discussion with him, he got me interested in, I think you should pursue your interest in public health, especially in biostatistics. I talked to my father, and then he became epidemiology and biostatistics. So I decided, if I'm not mistaken, in October to apply. I asked my father, where do you go? Where should I apply to? He said, apply to Harvard, the best. I said, okay. So I just made one application, right? I got my graduate GRE, the examinations that you have to sit. I took 1 night or 2 nights after work, just review a few questions, set for it, ultimately sending my application. And lo and behold, I was very fortunate that I got accepted. I delayed it by a year because I was looking for a scholarship. And I thank everyone involved who helped me obtain that scholarship. Then when I went to Harvard, something interesting happened. I thought I knew about epidemiology and biostatistics, right? Then I found I did not. That's the first thing, right? I spent a year, a very formative year. I still remember my professors, Frank Cook, Mittelman, Donna Spiegelman, who interestingly I met earlier this year. After don't know how many years, after 20 years, I met her again. Luminaries in public health, and then I learned what role public health actually plays in health in the US, right? So I stayed in Vanderbilt Hostel. Another interesting thing about my PhD, I left on my, I had my first daughter. Now Ayla, my wife delivered. And 3 days after she delivered her daughter, I left her. I came back 1 year later and I had a ready-made child. Right. Now, in view of time, so I decided to do my PhD in Hopkins, so that was Harvard. So why I did my PhD. So Hopkins was another very interesting decision. I discussed with Prof. Awang, again discussed with my mentor, my father, and decided that I will apply again to a number. So I did apply to Harvard and Hopkins and another seven more universities in the US. Got accepted to 5 of them, and I decided to join Johns Hopkins, right? And at that point of time, my target was always at Harvard. I had forgotten the role that Johns Hopkins plays to the field of public health. And when I joined it, then only I realized that if I wanted to pursue my education in public health, there is no better place to go than Johns Hopkins School of Public Health. At the School of Public Health, I actually met my advisor. I had 3 advisors. One was Elisa Goya, Moises Klo, and Carlos, right? And Prof. Juhi from Korea. So coming back to Eliseo, so this is Eliseo, this is Juhi. So Eliseo and Juhi got me involved with the Kangbuk Samsung Health Study Group. As you can see, we enjoy dinner once in like 6 months or once in 3 months, right? Meet a lot of Koreans, meet a lot of Chinese, and this is the core group of people that I worked with. There's also Sung Ho and Yusu, who were the 2 leads from Kangbuk. Now, why am I introducing this point about Kangbuk? Number 1 is collaboration, international collaboration, learning how to work. But more importantly is it got me involved with the Kangbuk Samsung Hospital Cohort, right? Where I got involved with the data management, and because with the data management, I started getting access to this data of 277,667. Interestingly, I did various work, and I think 1 year, that means after my 4th year, I remember getting an email from Prof. Awang saying, Sanjay, time to get back. I said, okay. So then I decided to complete my doctoral studies in the field of diet and cardiometabolic risk factors. So I analyzed a data set of 220,979 for diet and cardiometabolic risk factors. And further delved into a subpopulation on coronary artery calcium, subclinical arteriosclerosis, with a cohort of 27,028. So this led me to deriving 3 Korean dietary patterns. I know lots of colors, lots of information. But key thing here is, I think to summarize it, we found out that the modern Korean diet, right? The modern Korean diet was high in meat, processed food, alcohol, and compared with the traditional Korean diet, high in vegetables, fruits, soya, mushrooms, so on and so forth. So when you compare both of these, the modern Korean diet actually had higher risk of metabolic syndrome and coronary artery calcium. However, this coronary artery calcium, which was supposed to be my novel question, turned out to be non-significant. But life goes on, right? Then I also managed to collaborate with Samsung Medical Center. So one was Kangbuk, and one was Samsung. So together with a group of people, I helped them got access to 21,688 consecutive colonoscopies. And here I learned a new one of the analyses that I learned is multiple imputation. And I started using multiple imputation to help address missingness in both cohorts. Because of this, I had access to this data set. And with this data set, I looked at the associations between markers of adiposity and colorectal adenoma. Now I know, again, lines. For those who cannot appreciate the statistics, key thing here is higher BMI, higher risk of, can think of it as higher risk of colorectal adenoma. And colorectal adenoma is a precursor of colorectal cancer. So what this shows you is risk factors that we think are traditionally associated with cardiovascular are also associated with other non-communicable diseases, such as cancer. And this is because they share common pathophysiological metabolic pathways between exposure and the disease. Now, in addition to doing analysis on markers of adiposity, which you can think of it as a marker of obesity, I also delved into the other markers. For example, markers of dyslipidemia. That means when you have high lipid levels. And I actually found very interesting relationships between high lipid levels and colorectal adenoma. One interesting thing that I learned during my working with LICO was that when you present information in a table, it is easy to read for the informed. It is difficult to be interpreted by the common man, common person. For the lay person, when you put it out in some wavy lines, right, make sure it's colorblind friendly, it's easier to be digested, right? And also that there was a lot of information in dose-response relationships. We were not utilizing dose-response analysis enough. A lot of times, we simplify information into either binary, high-low, or low, medium, high, so on and so forth. We lose a lot of information in the categorization of data, whereas dose-response information is much more informative. Now, when we talk about the papers that I published, actually, this paper was an interesting paper because it took me once starting to work with a group, it took me about a year to 2, and this was my first major paper, right? And this paper, the dyslipidemia paper and the glucose metabolism paper, came out in very high Q1 journals in gastroenterology. And that helped me learn how to submit manuscripts to high-impact journals. Once I started working on missingness, I said, why don't I address missingness in the first study I had, the first study I showed you, where there were 30 to 40% missing. So then I used missingness, multiple imputation to address missingness, and I came out with this relationship between central obesity and ethnicity. And this is very interesting to me, right? Because when you look at relationships, and this is by the age, by the different age groups, relationships usually are like this, right? Where one group is at a higher risk of another group. So when you compare Indians to Malays, consistently Indians are higher than Malays. Makes sense, consistency. However, when you look at the relationship between Chinese to Malays and indigenous Sarawakians to Malays, there's something going on. This actually points out to that the relationship is different by age. This highlighted that there may be a cohort effect. The older generation of indigenous Sarawakians and the older generations of Chinese may be more protected against central obesity, and later you see metabolic syndrome, compared with the younger generations. There was something going on with our younger generations. Maybe we eat more alike, we live more alike, and as such, we share more similar risk. Convergence of risk factors among the different ethnic groups in our younger generations of Malaysians. Now, I'll skip this due to time. And another important thing I found out in the US is balancing work and family, work-life balance, right? Number one. Number two, why I show you the pictures on the left, is actually practicing a healthy lifestyle is very important, right? In the US, the lifestyle, maybe the community I was living is not representative of most of US. I was living in the inner suburbs until my family came, and the inner suburbs basically show you true Baltimore life. But when they came, I moved to the outer suburbs, right? And in the outer suburbs, there were a lot of parks to walk around and to spend your time for your recreation and physical activity. Ultimately, I completed my PhD in 2014, about 1 year, I think. 1 year after Prof, I want to say, time, let's go. Took me 6 months to write, submitted it, then took me 6 months to sort out the rest. In Hopkins, I stayed in Reed Hall, a hostel, for 1.5 years, where it was a very interesting experience. This it's just Johns Hopkins Hospital, right? And this is a cherry tree. All right. Now, as I said, the work that I did in the 2004 cohort portended that there was a generation effect. It took me some time doing other research until I gained a suitable doctoral student, right? Her name is Dr. Tay, who is now who's completed and awaiting graduation, got her Senate letter. But she looked at trajectories of various factors through time and through age. So number one here you can see is age trajectories of BMI. What you notice is with increasing age, the BMIs increase, expected. But what you do see is you do see some differentiation between the females and males, right? With increasing age, the BMIs of females appear to be increasing. Then we took this a step further and we said that, is this sex effect or gender effect homogeneous through the different ethnic groups? And this is what we found. We found that the Chinese, right, and these other indigenous groups had actually lower trajectories compared with Malays and Indians. Malays and Indians actually were very similar through the age spectrum. On the left, among males, and on the right, you can see further differentiation. There's something in their lifestyles, right, among the female, that there was a wider differentiation between the Chinese. However, the indigenous groups were approaching normal, right? So this is with age. This is the cohort trajectories. What a cohort trajectory says is if you were born in any of those years, what would your average BMI be? And what you can see is with successive cohorts of population, right, the BMIs are actually increasing with time. And the BMI is higher for females compared with males. And the relationship here, when you talk about generational effect, is that Malays, Indians, and other indigenous, and here other indigenous includes indigenous Sarawakians, Sabahs, and indigenous Peninsular Malaysians, that they were similar actually in the way the trajectory has moved along. However, there was a distinct difference with the Chinese ethnicity. And this portended possibility that lifestyles, diet especially, and physical activity and health-seeking behavior may be different by these different ethnic groups. Now, I am at 27 minutes, a couple of 15 minutes left, right? So now I move on. on two things. Just give me, yeah. So I'm going to move on from research to a separate field. The field actually is about advocacy and engagement. And I sample only, I just sample a few topics. So the first topic that I want to talk about is in COVID, during COVID. So when COVID occurred, it was a very interesting time where there was a lot of misinformation, right, in the initial stages, right? There was a lack of clarity, a lack of epidemiological insight for normal layman Malaysians, actually the world, right? And at this time, the department was very strategic in what it did, in that we had our academics engage with media. So various academicians contributed many pieces, articles, interviews. Prof. Awang also led a very big group, the CEASE project, and was also a very important advisor, right, during that time. But to me, this was like my first time that I started engaging with media. I never seriously engaged with media because I was always in the university. I was always working. At that time, I was helming the department, so on and so forth. But when COVID happened, I decided to start writing to media, right? To get my first paper accepted was difficult. I wrote a few times. Nobody replies you, I tell you. When they reject you, they don't even say, we reject you, thank you. There's nothing. You just submit and you're going like, okay. Submit another one, okay. I think it was about my third or fourth try when one hit. And this is interesting. Because when that one article got picked up, suddenly out of the blue, more and more articles got picked up. And as my articles in the papers got picked up, the radio started getting, the other news portals started getting whiff of what I was contributing. So during this time, I contributed 29 articles which were accepted, 2 news media. This is original articles that come out in opinions pieces, not all by myself. So I had one with Prof. Awang, I had one with Prof. Nilmala, I had one with Prof. Tarani, and I had one, I've had a few with Moy and many others, right? But my point here is once you start writing, when the media starts getting interested in you, when you have a message that they want to listen, they come to you, right? So this then led to a number of interviews that I did with BFM, with CNA radio, and there was an Australian news channel also, right? So in addition to that, we found out that there was not much information on COVID in Malaysia at that time. When I say information, I'm talking about epidemiological insights. That is where I was very lucky to have another colleague of mine, now specialist, Dr. Vivek Jason, who initially we were going to investigate we were going to do some multi-level spatio-temporal analysis of cancer. COVID came, we switched, and we focused on disease transmission. COVID-19 disease transmission, right? And one of the things that happened is we came out with a dashboard, right? The COVID-19 epidemiology for Malaysia dashboard. The amount of information that we were giving on this dashboard, a lot of information given. And what we did was, what the department, not I, what the department did was, we got our students to write weekly reviews of COVID insights, right? And we published these weekly insights, number 1 on the web, number 2, we circulated it, and many news media also picked up on it. And this could tell you whether, was it worsening, was it getting better, so on and so forth. But we were providing evidence-based, appropriate statistics to basically to people health policy and to the layman. Now the department, when I said this is not me, this is the department. The department, I think, was very successful in engaging the media during the pandemic. We have many, many cohorts that included all our department staff, and there was a total of 446 posts during that period, right? So that deals with advocacy, engagement. Now comes to public health. I know my synopsis talk about obesity, public health challenges, address, blah, blah, blah. I only got 45 minutes. I want to talk a lot. Right, so I had to make some sacrifices. So if you're interested in knowing more about what the synopsis has stated, PM to P, we can further discuss on the side. Right? With public health medicine, among the many things I did, I think one important thing that I've done, that I've contributed, not alone, is I've chaired the Public Health Medicine Specialty Education Subcommittee, under the Specialist Education Committee, under the Medical Education Committee, under Malaysian Medical Council, right? And over a period of 3 to 4 years, right, we have come out with the specialty-specific standards. I worked together with Dato Indra, Dr. Shari Ngadiban, Prof. Dato Dr. Lokman Hakim, Prof. Jamaluddin, Dr. Anita, I missed out Dr. Zul's name somehow, Dr. Zul from BPKA, and we work with the public health fraternity, including the Conjoint, Jawatankuasa Bersama Kepakaran Bidang Perubatan Kesihatan Awam, the College of Public Health Medicine, and the Association Persatuan Pakar Perubatan Kesihatan Awam, and the various arms of Ministry of Health. We work together to come up with a consensus of what we want our future public health medicine specialists to be. What should training programs be? Right? And importantly, we move to a competency-based framework. What are the competencies we want from our public health medical specialists? So that's my bit on public health. 10 more minutes, gonna move on. Now, I've been due to give this presentation, I think, about now 6 years, at least 6, 7 years. I've not gotten to do that for various reasons. One phenomena may be imposter syndrome. I feel that I don't deserve it, right? You get lost from day-to-day work. You get lost in the weeds, in the trees, that you fail to see the forest. I had a very interesting interactions with past students in a previous conference, just a conference held in Kuching, Asia Pacific Conference of Public Health. What happened at this conference is, I met many people, and everybody was like, hey, Prof. No, I'm Sanjay. No, Prof, you taught me. And then you realize that you have taught a generation of public health medicine specialists. But when we teach, and I say it's not me, we, academicians teach, we don't actually think about it. We do because that's our responsibility, that's our duty. We don't even think much about it after that. It's not that, oh, I groomed you and now I am so-and-so. Nothing. The cohort goes out, another cohort comes in. We just had a new cohort of Master of Public Health, new cohort, DRPH. Right? As academicians, we just grind on, produce, we do the best we can, but we don't think, sometimes we don't spend time. This time I must take responsibility as me. I didn't spend the time reflecting. What is the impact of what I'm doing? I always thought impact was research. Impact is publication. But actually a lot of work an academician done cannot be measured by publication. It is measured by successive generations of workforce that you produce, and more important, their impact on the society. That is key. Now, talking about that, I went and reviewed my CV. So usually my CV is I just fill out the publications and I move on from every 3 or 6 months, I just fill out my publication. But in preparation of this, I wanted to acknowledge the students that I've supervised and co-supervised through the years. So I have a group of students from 2005 to 2009, 2010, right, who basically completed their public health medicine specialists. I did not supervise all of them alone. I supervised them through the other units and with varying academicians, right? So I have Dr. Harish. I won't name the doctors, I just keep it to the names to keep it fast. We have Harisha, Noli, Siti Rohana, Areza, Maslino, Nick Nairan, Sunita, Rohana, Sharil, and Rafida. I tried to get everyone's photos, but I did this kind of last minute and they were busy. So who I had, they're up here. And when we look, so I went off, after for my PhD, I came back. And since then, I have a number of public health medicine specialists who have completed their Doctor of Public Health. I have Fariza Harriman, who is a Brig Gen in the military. I have Noor Huda, Siva Rajan, Khairia, Sophia, Ali Zarina. Many of these work in Ministry of Health. They work in the universities and other government and private agencies. I've also supervised, helped, mentored Shiz, Rosvinder, Ruben. Interestingly, Shiz, Rosvinder, Ruben, and Eliana was from one batch, one cohort. Suddenly I came back, I had no students, so why not take 4 students at once? It was a very good experience, actually. Then, so we have Shiz, Rosvinder, Ruben, Eliana, then Chong, co-supervised with Chuan and Pitagan. Then, there was also Diane. I think I saw Diane around. I saw Vivek Jason around. Ruben is around. Abu Beheda was a very interesting co-supervision with Victor. He was an international student who came, did his DRPH with us, and now is applying to be accredited, recognized under the Saudi, in the Saudi. I've also supervised Cassidy. I am currently supervising An and Jung, who hopefully will finish very, very soon. That's with the DRPH. Coming to PhD, I've supervised Joey, Mufta, Te. Kamarul and Shazwani should be completing their corrections very soon. Then these are students who are in ongoing supervision. Some of you, if you see your faces here, hopefully you will finish sooner than the others, right? It is what it is. It's a journey. So talking about students, I'll just take a 1-minute detour about my PhD. If you ask me what is a PhD, PhD is a journey you take where you dig a hole. You keep digging the hole. You dig it so deep that you lose sight of light. You keep digging because whenever you talk to your supervisor, you look at the data you have, you look at the methods, you dig. This is digging for knowledge, right? Then one day, you'll get a clarion call. What the clarion call is differs from person to person. For me, as I said, it was Prof Awang saying, Sanjay, come back. Right, and then when you receive that clarion call, whatever you're doing, believe me, if I stayed back in the US, I could have contributed a lot more, right? But you stop and you say, what do I have to do to complete my journey, this journey? When we join PhD, sometimes we think, or doctoral journey, we think this is the culmination of my knowledge. It is not. It is the beginning. Get it over with and move on with life, right? So the impact we made. This is another very interesting event I went for. I was invited. I think it was the NIH Mohem meeting. And Moy was there, Prof Moy was there. And suddenly we met this group of students who had graduated from our department in NIH. Such a large group of students, right? And it was very convenient. Then we said, come on, let's take a photograph. And it started off actually with 3 people, but eventually we got the whole village. Now, I've talked about, but one thing I've not talked about is my MPH 1 year. So I've also supervised 1-year master students. I value supervising all of you. But the time we spend with our 1-year master students is not that much. Now, few lessons I've learned. I have about 3.5 minutes. So the first lesson, developing and sustaining collaborations. It takes time, it takes energy. You need to be culturally competent, especially when you're dealing with people from different cultures, people from different countries, people from different societies, right? You have to be competent. You have to look out for the way you communicate. Key thing is though, you have to invest the time. Collaborations don't start out of the blue. You have to continuously build at it. There will be a point, an inflection point, when suddenly things start to work. But until then, you have to persevere. Number 2, be a lifelong learner, right? I think adopting a growth mindset is very, very important. You should accept the limitations that you have. You should try to go beyond them. One more important thing is remain humble regarding our current understanding of the universe. Personally, this is something that I've gone through. When I came back with an MPH from Harvard, I thought I was great. Right? When I used to evaluate students, we call that the young lecturer complex, right? We used to go really hard on them. Because we are dogmatic sometimes. When you start learning something, you become dogmatic in that field. However, with further knowledge, with further growth, you learn to become humble. And I really like the quote by Karl Popper. With increasing knowledge comes a better articulation of our ignorance, raising awareness of what we still do not know. So the more knowledge you gain, the more humble you become, because you become aware of how more ignorant you don't know, or you become more aware of what you do not know. Another lesson, perform your duties while detaching from its rewards. I think this is important. Do the best you can, right? But don't get emotionally attached to what you're doing. I found that to be a great coping mechanism because whenever you have a task, focus on the processes, get the best you can do, but the result, be it success or failure, don't get emotionally attached. That means if it's success, don't go hurrah, hurrah. If it's a failure, don't come down and say, oh, sad our life. It's because you detach from the outcomes. You just focus on your duty. You focus on your responsibility. Another lesson, be kind. Be kind and compassionate to your fellow students, staff, and community. For academicians around here, especially be kind and communicate well with your colleagues. Because like it or not, we are stuck here together until you retire, right? So be nice to one another. If you fail, it is better to fail early. It's very important that we all face failure. We will face failure. Be resilient to failure and move on. Finally, find an equilibrium between work, life, and universe. When I was writing, this came out from a discussion I had with my supervisor, right? And he told me, there are things we like to do, things we are good at, and things we are known for. So that led me to this. While some individuals may find that their passions align with their professional recognition and financial rewards, many face a complex interplay among your various pursuits. Finding equilibrium is essential for overall well-being. Find your center, maintain your center. With that, I'll come to the acknowledgements part. I would like to thank my family. I would like to thank my father, Lekhraj Rampal, my mother, Surendra Kaur, my brothers, as you can see from various stages of life, right? We have Sanjay Rampal, Rajiv Rampal, and Rajesh Rampal. All who have done very well as orthopedicians. I would also like to thank my more immediate family, my wife, Lalita. I'd like to thank Tanisha, Tanushri, Brenda, and Ritisha. Having an understanding wife, I think, is very, very important for a man. Right? She has been my rock, my center. She has been there through time. And I thank you for it. And the kids. Something about kids, right? They teach you new things in life. You think you know about life, and then you have kids, and they just keep on teaching you new lessons in life. Next, I would like to thank the management, Faculty of Management, Faculty of Medicine. I'd like to thank Prof. Young, Prof. Sharo, Prof. Yazid, Prof. Azlina, Prof. Tengku Ahmad, and our excellent Madam Sarina. All of them and all other staff and officers at the Dean's Office help facilitate my work as Deputy Dean of Research. I know I'm running on 2 minutes past time. Acknowledgements, what do you do? I would like to thank Prof. Aihui, see her there, who has been one of the bedrocks. Prof. Aihui and Prof. Vairavarman have been one of the bedrocks of the research unit. They keep it ticking. They help me tremendously in ensuring that we help our faculty do the best we can. I also like to thank all the other research unit heads, the research lab heads. As stated here, because of time, I will not be naming them, but you can see them, and they're there. This was a very interesting photograph. It got me thinking, how many people contribute directly to to supporting research in our faculty? And the number I got up was about 100. We have about 100 academic staff who contribute their time to the faculty to ensure that our output and impact is as high as it is good. For that, I thank all of you from the bottom of my heart. Second last, one more slide after this. Second last is we have the research office. I would like to thank all my staff at the research office who, you all are all there. As due to time, I'm just going to skip the names, but you can see there. I thank you all. You help make my work a lot easier every day, and you help our staff directly in producing better impact, higher impact research. I'd like to thank the department, all the academic staff of the department. Actually, this is a bit dated. I was trying to get a newer photograph, couldn't get. Right, last minute. So I'm very sorry if I left out Bala and other newer ones. But I'd like to thank each one of you for your friendship, for your collegiality. And actually, initially we were work colleagues initially, but through time, I think I've spent more time with you all than I've spent with, I spend more time with my wife. But I spend more time with you all than my children, right, over time. Right. Now, this was the picture you saw on the left. This was the picture I started with. When you do your inaugural, you feel you're on top of the world. There are many roads leading to it. You have taken one road, but you are at the pinnacle. Then I thought to myself, am I really? And then you hear about S-curves. So S-curves say is when you've reached the pinnacle and you're comfortable, you're not where you're supposed to be. You're not doing what you're supposed to do. You have to improve. Because when you think you're at the pinnacle, you have opportunity to either further grow or deteriorate. That's the S, right? And life then becomes a series of S-curves. And with that, I leave you with this. Because I'm not sure where I'm going. Most likely I'm going to jump, right? But I hope to continue exponentiating my knowledge, my expertise, and my service to the nation. With that, thank you all.
Thank you, Prof. Sanjay, for a very insightful lecture. I would like to invite Prof. Dr. Yang Freda back to the podium to summarize and conclude for Prof. Dr. Sanjay Rampal's inaugural lecture. Thank you, Prof.
Thank you, Dr. Bala. Well, I quickly took out my phone and I Googled imposter syndrome. And I'm going to read it to you. It is the persistent inability to believe that one's success is deserved or has been legitimately achieved as a result of one's own efforts or skills. I think what Sanjay shared, Prof. Sanjay shared with us today clearly showed that that's not true, Sanjay. So I want to announce officially in this inaugural lecture, you are not an imposter, and I think everyone can attest to that. It was actually very inspiring to see your life journey and to first be shown with that letter thing, I don't know what it's called, the cloud thing, the word cloud. And of course, you were trying to bring us to Malaysia and obesity, but I think most of us were interested in Kangbuk and Samsung, I think. So very happy that you managed to explain to us what that meant later on. But I think as you go through, as Prof. Sanjay showed, to get where he is today, it is a mixture of different things. It is a mindset, it is the way you approach things, it is your skills, bringing in your skills, bringing in how you feel, your emotions. And if I could just consolidate some of them, I would not be able to do as good a job as Prof. Sanjay did, but I will consolidate some of them. I think the first one is personally, professionally, what you have talked upon is on being able to reflect on your research findings and how you reflect on that and focus on missingness. But at the same time, using that reflection to reflect on your life and your actions. And I think that is very powerful, and we should never forget to do that. I think you showed us the audacity of applying big. And we should never limit ourselves. I think most of us limit ourselves because and in the end, what Prof. Sanjay showed is you can just ask, and the answer may be yes. And sometimes the answer may be 5 times yes, as with your PhD. And I think you talk about the impact of networking and collaboration and how important that is. The tenacity of putting your message out and wanting to be heard. The flexibility of being adaptable and yet at the same time accept the outcome of whatever that you do. The strength of teamwork and the satisfaction and selflessness of sharing and training the next generation. And personally, I think Prof. Sanjay talked about the importance and prioritization of work-life balance and the ability to be empowered by mentors, and how wonderful it is if the mentor happens to be your own father. That's very, very important. And generally, to just adopt, to accept the power and understand the power of humility, the power of kindness, and the power of growth mindset. And finally, you should learn from your children and from the younger people. And I think that is a very strong message indeed. So I want to congratulate you, Professor Sanjay Rampal, for that wonderful lecture and for your sharing. Congratulations.
Thank you very much, Prof. Yang. Now I would like to invite Prof. Yang and Professor Dr. Sanjay for a brief photo-taking session. Prof. Yang, Prof. Sanjay, could you please be seated? We want to take a group photo. All the others can be just seated. At the center, yeah, we can come towards the center. All on the side, towards the east and west wing, or stand, huh? Okay. Kindly request everybody to stand, if possible. Yeah.
Okay, ready. Okay, count 1, 2, 3. Couple 1, 2, intensified.
Thank you, Professor Dr. Yang Farida, for presiding over today's inaugural lecture. And our deepest appreciation to our beloved Professor Dr. Victor Ho and Professor Dr. Sanjay Rampal for delivering such insightful and inspiring presentations. Ladies and gentlemen, this concludes our event for today. Thank you for sharing this remarkable moment with Professor Dr. Victor Ho and Professor Dr. Sanjay Rampal, both from the Department of Social and Preventive Medicine, Faculty of Medicine, Universiti Malaya. To commemorate today's event, we will be having a photography session with Prof. Victor, Prof. Sanjay. So I would like all family members